Phlebotomy Certification Exam Capillary Puncture Questions. Question 1. For an infant heel stick, which area is safest for puncture in the emergency department bay during a study session? Option A, tip of the great toe. Option B, medial or lateral plantar surface of the heel. Option C, posterior curvature of the heel. Option D, center of the arch. The correct answer is option B, medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The great toe is not the standard infant heel stick site. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. Question 2. Why should an infant heel puncture not be too deep in the physician office lab during a structured exam prep drill? Option A. A deep puncture replaces the need for warming. Option B. A deeper puncture always prevents hemolysis. Option C. Excessive depth can injure bone or deeper tissue. Option D. Depth determines the tube color. The correct answer is option C. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Warming is a separate step used to improve blood flow when appropriate. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Question 3. To protect patient safety, which finger is generally preferred for adult capillary puncture in the community health screening event during a clinical simulation? Option A, little finger near the bone. Option B, thumb pad for every test. Option C, index fingertip in all adults. Option D, middle or ring finger on the palmar surface near the side of the fingertip. The correct answer is option D, middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The little finger has less tissue over bone and higher injury risk. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. Question 4. After a finger puncture, why is the first drop of blood commonly wiped away in the preoperative testing area during a review? Option A. It may contain tissue fluid or contaminants that can affect the specimen. Option B. It activates the tube vacuum. Option C. It contains only white blood cells. Option D. It proves the patient is fasting. The correct answer is option A. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. Capillary collection does not depend on evacuated tube vacuum at the puncture site. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Question 5. How can warming a capillary puncture site help collection in the Oncology Infusion Center during a mock exam? Option A. It makes every specimen suitable for culture. Option B. It increases local blood flow when used safely. Option C. It sterilizes the skin completely. Option D. It removes the need to identify the patient. The correct answer is option B. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Capillary specimens are not automatically suitable for blood culture collection. Warming does not sterilize skin. Patient identification is still mandatory. Question 6. Why should excessive squeezing or milking be avoided during capillary collection in the dialysis adjacent clinic during a skills check? Option A. It prevents clotting in serum tubes. Option B. It improves all glucose results. Option C. It can dilute the specimen with tissue fluid and cause hemolysis. Option D. It makes EDTA unnecessary. The correct answer is option C. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Serum tubes are intended to clot and are not protected by squeezing. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Question 7. When is dermal puncture commonly preferred over venipuncture in the student skills lab during a practice drill? Option A, whenever patient identification is incomplete. Option B, for every blood culture set. Option C, for all coagulation studies regardless of policy. Option D, for some infants, small volume tests, or patients with difficult veins when appropriate. The correct answer is option D. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Incomplete identification must be resolved before any collection method. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Question 8. During a scenario, which capillary specimen is most likely to clot if collection is slow and mixing is delayed? Option A, EDTA microcollection specimen for hematology. Option B, a properly filled citrate tube mixed immediately. Option C, a fully clotted serum specimen after clot time. Option D, a sealed blood culture bottle. The correct answer is option A, EDTA microcollection specimen for hematology. Small capillary volumes clot quickly, so EDTA hematology specimens need prompt collection and mixing. Promptly mixed citrate tubes are designed to prevent clotting for coagulation testing. Serum specimens are intended to clot before processing. Blood culture bottles are not typical capillary microcollection tubes. Question 9. If a phlebotomist sustains a needle stick during a competency review, which action should happen first? Option A, ignore it if the patient looks healthy. Option B, wash the area immediately and follow the facility exposure reporting procedure. Option C, finish all remaining patients before reporting. Option D, recap the needle to identify its size. The correct answer is option B. Wash the area immediately and follow the facility exposure reporting procedure. Immediate cleansing and prompt reporting support timely exposure evaluation and follow-up. Appearance does not determine whether a blood-borne pathogen risk exists. Delaying the report can delay medical assessment and documentation. Recapping increases sharps injury risk and is not needed to report the exposure. Question 10. Why should contaminated needles generally not be recapped after venipuncture in the outpatient clinic during a final review? Option A, it makes the tourniquet too tight. Option B, it causes all specimens to hemolyze. Option C, recapping creates a preventable sharps injury risk. Option D, it changes the additive in the tube. The correct answer is option C. Recapping creates a preventable sharps injury risk. Recapping requires bringing the hand back toward the contaminated sharp, which increases needle stick risk. Tourniquet tightness is unrelated to needle recapping. Hemolysis is affected by collection and handling factors, not by recapping alone. Tube additives are not changed by whether a needle is recapped. Question 11. When a sharps container is near the fill line in the hospital unit during morning rounds, which action is safest in the hospital unit during morning rounds during a study session? Option A, continue using it until the lid will not close. Option B, push the contents down to make space. Option C, place extra needles in a biohazard bag. Option D, replace or close it according to facility policy before it becomes overfilled. The correct answer is option D. Replace or close it according to facility policy before it becomes overfilled. Sharps containers must not be overfilled because protruding sharps can cause injury. Waiting until the lid fails creates an avoidable exposure hazard. Pushing contents down places hands near contaminated sharps. Biohazard bags do not provide puncture protection for needles. Question 12. After reviewing the order, which item is an engineering control used to reduce blood-borne pathogen exposure in the urgent care laboratory during a structured exam prep drill? Option A. A safety-engineered needle with a protective device. Option B. A longer tourniquet. Option C. A reminder poster only. Option D. A handwritten exposure note. The correct answer is option A. A safety-engineered needle with a protective device. Engineering controls isolate or remove the hazard through device design, such as safety needles. Tourniquet length does not protect against needle stick injuries. A poster may educate staff but does not physically control the sharp. A note documents information but does not prevent exposure. Question 13. During a blood spill cleanup, which approach is most appropriate in the pediatric clinic during a clinical simulation? Option A. Use bare hands if the spill is small. Option B. Wear proper PPE and use an approved disinfectant according to policy. Option C. Wipe the spill with dry paper towels only. Option D. Ask a patient to avoid the area and leave it. The correct answer is option B. Wear proper PPE and use an approved disinfectant according to policy. Blood spills require PPE and proper disinfection because blood may contain infectious material. Bare hands create direct exposure risk even with small spills. Dry towels alone do not disinfect contaminated surfaces. Leaving the spill exposes others to contamination. Question 14. In a routine phlebotomy scenario, which resource should be checked for safe handling information about a chemical disinfectant in the long-term care unit during a review? Option A. The tube expiration label only. Option B. The patient's wristband. Option C. The safety data sheet. Option D. The OrderOfDraw chart. The correct answer is option C. The safety data sheet. A safety data sheet explains chemical hazards, PPE, storage, and spill response. A tube label may show expiration but not chemical handling instructions. A wristband identifies the patient but gives no chemical safety guidance. An OrderOfDraw chart does not address disinfectant hazards. Question 15. Before proceeding with the draw, which vein is usually preferred for routine venipuncture in an adult antecubital area in the mobile collection site during a mock exam? Option A. Vein on the underside of the wrist. Option B. Basilic vein as the first choice. Option C. Femoral artery. Option D. Median cubital vein. The correct answer is option D. Median cubital vein. The median cubital vein is commonly preferred because it is usually well anchored and less likely to roll. The underside of the wrist has higher risk for nerve or tendon injury. The basilic vein is closer to nerves and arteries and is usually not the first choice. The femoral artery is not a routine venipuncture site for phlebotomists. Question 16. How should the needle bevel generally be positioned when entering a vein in the emergency department bay during a skills check? Option A. Bevel up at an appropriate shallow angle. Option B. Flat against the skin without entering. Option C. Bevel down at a steep angle. Option D. Sideways with the tube already removed. The correct answer is option A. Bevel up at an appropriate shallow angle. A bevel-up approach helps the needle enter the vein smoothly and supports blood flow into the collection system. A needle flat against the skin will not properly access the vein. A bevel-down steep approach can increase discomfort and may pass through the vein. A sideways needle position is unstable and not standard technique. Question 17. At what angle is a routine venipuncture needle commonly inserted in the physician office lab during a practice drill? Option A. Parallel under the skin for several inches. Option B. About 15 to 30 degrees. Option C. About 5 degrees for every adult. Option D. About 60 to 90 degrees. The correct answer is option B. About 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter the vein without going too deep. Advancing parallel for several inches increases tissue trauma and is not standard venipuncture. A very shallow angle may fail to enter the vein or may drag under the skin. A 60 to 90 degree angle is more likely to puncture through the vein. Question 18. Before inserting the needle for a bilirubin, why should the selected vein be anchored in the community health screening event during a scenario? Option A. It allows the tourniquet to stay on longer. Option B. It sterilizes the skin. Option C. Anchoring stabilizes the vein and reduces rolling during entry. Option D. It replaces the need to cleanse the site. The correct answer is option C. Anchoring stabilizes the vein and reduces rolling during entry. Anchoring stretches the skin and helps keep the vein steady as the needle enters. Anchoring does not justify prolonged tourniquet time. Anchoring does not sterilize skin or remove microorganisms. Skin cleansing is still required before puncture. Question 19. After cleansing a venipuncture site with alcohol, when should the needle be inserted in the preoperative testing area during a competency review? Option A. After wiping the area with a used gauze pad. Option B. Immediately while the alcohol is wet. Option C. After blowing on the site. Option D. After the site air dries completely. The correct answer is option D. After the site air dries completely. Allowing alcohol to air dry improves antisepsis and reduces stinging and hemolysis risk. Used gauze can reintroduce microorganisms to the puncture site. Puncturing through wet alcohol can sting and may affect specimen quality. Blowing on the site contaminates the cleaned area. Question 20. How long should a tourniquet generally remain in place before it risks hemoconcentration in the oncology infusion center during a final review? Option A. No longer than about 1 minute. Option B. Only after the patient pumps the fist repeatedly. Option C. At least 5 minutes for every draw. Option D. Until all labels are printed. The correct answer is option A. No longer than about 1 minute. Tourniquet application beyond about 1 minute can concentrate blood components and alter some results. Repeated fist pumping can also contribute to hemoconcentration. 5 minutes is excessive and can distort laboratory values. Administrative delays do not justify prolonged tourniquet use. Question 21. When should the tourniquet be released during routine tube collection in the dialysis adjacent clinic during a study session? Option A. After 5 minutes to improve the specimen. Option B. As soon as blood flow is established and before removing the needle, following policy. Option C. Only after the patient leaves. Option D. Before the needle ever enters the skin in every case. The correct answer is option B. As soon as blood flow is established and before removing the needle, following policy. Releasing the tourniquet once blood flow is established helps reduce hemoconcentration and patient discomfort. Prolonged application does not improve specimen quality. Leaving it on until the patient leaves is unsafe and unnecessary. Removing it before needle entry in every case may make vein access difficult. Question 22. Why should patients avoid repeatedly pumping the fist during venipuncture in the student skills lab during a structured exam prep drill? Option A. It guarantees faster clotting in citrate tubes. Option B. It sterilizes the collection site. Option C. It may alter analytes such as potassium through hemoconcentration and muscle activity. Option D. It prevents all hematomas. The correct answer is option C. It may alter analytes such as potassium through hemoconcentration and muscle activity. Repeated fist pumping can change blood composition and affect certain test results. Citrate tubes are anticoagulated and do not rely on patient fist motion. Fist pumping has no antiseptic effect on the skin. Hematoma prevention depends on technique and post-draw pressure, not fist pumping. Question 23. Before proceeding with the draw, which needle gauge is commonly used for routine adult venipuncture with evacuated tubes in the occupational health clinic during a clinical simulation? Option A. A lancet designed for heel stick only. Option B 12-gauge needle. Option C 30-gauge needle for all adults. Option D 21 or 22-gauge needle. The correct answer is option D. 21 or 22-gauge needle. A 21 or 22-gauge needle usually provides adequate flow while limiting trauma for routine adult veins. A heel stick lancet is not used for routine venipuncture. A 12-gauge needle is unnecessarily large and traumatic for routine phlebotomy. A 30-gauge needle is too small for standard evacuated tube collection and may slow flow. Question 24. For a patient with a small fragile hand vein, which device may improve control in the blood collection station during a review? Option A winged infusion set with appropriate tube or syringe technique. Option B unprotected straight needle used without a holder. Option C large bore blood donation needle. Option D heel puncture lancet. The correct answer is option A. Winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. Using an unprotected straight needle without a holder is unsafe and not standard practice. A large bore donation needle is excessive and can injure a small vein. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Question 25. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first in the outpatient clinic during a mock exam? Option A. The discard tube replaces patient identification. Option B. The tubing airspace can underfill the citrate tube and disturb the blood-to-additive ratio. Option C. The discard tube warms the patient's arm. Option D. The discard tube removes EDTA carryover from the skin. The correct answer is option B. The tubing airspace can underfill the citrate tube and disturb the blood-to-additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. No tube can replace proper patient identification. A discard tube is not used to warm the arm. EDTA carryover is managed by order of draw, not by removing it from the skin. Question 26. If no blood enters the tube after needle insertion, which action is safest first in the hospital unit during morning rounds during a skills check? Option A leave the needle in place while searching for another vein. Option B probe deeply until blood appears. Option C gently adjust needle position while staying within policy and patient comfort limits. Option D turn the needle in circles under the skin. The correct answer is option C. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. A needle should not be left in one site while searching elsewhere. Deep probing increases pain, hematoma risk, and nerve injury risk. Rotating the needle under the skin is traumatic and not appropriate. Question 27. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do in the urgent care laboratory during a practice drill? Option A release pressure only after all tubes are collected. Option B advance deeper to pass the nerve. Option C ask the patient to ignore it until the tube fills. Option D stop the draw, remove the needle safely, and follow facility procedure. The correct answer is option D. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Continuing tube collection delays the response to a possible complication. Advancing deeper can worsen nerve injury. Ignoring the symptom places the patient at unnecessary risk. Question 28. During a difficult draw, why should excessive probing be avoided in the pediatric clinic during a scenario? Option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Option B. It prevents the need for patient identification. Option C. It improves all specimen results. Option D. It sterilizes the vein. The correct answer is option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Patient identification is always required regardless of draw difficulty. Probing does not improve laboratory accuracy. Needle movement has no sterilizing effect. Question 29. If a vein collapses during evacuated tube collection, which change may help on a redraw in the long-term care unit during a competency review? Option A. Tell the patient to pump the fist continuously. Option B. Use a smaller tube, syringe, or winged set according to policy. Option C. Use a stronger vacuum tube on the same fragile vein. Option D. Keep the tourniquet on for several minutes. The correct answer is option B. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. Continuous fist pumping may affect analytes and does not solve vein collapse. A stronger vacuum can worsen collapse. Prolonged tourniquet time can alter results and increase discomfort. Question 30. In a routine phlebotomy scenario, which site should generally be avoided unless specifically approved by policy or provider order in the mobile collection site during a final review? Option A. A suitable cephalic vein. Option B. A well-palpated median cubital vein. Option C. A foot or ankle vein. Option D. An acceptable dorsal hand vein. The correct answer is option C. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. The cephalic vein can be appropriate when assessed carefully. The median cubital vein is a common routine site when suitable. A dorsal hand vein may be acceptable when antecubital veins are unavailable. Question 31. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture in the emergency department bay during a study session? Option A. It eliminates the need for a tourniquet. Option B. The blood in that arm has no cells. Option C. All tubes drawn from that arm turn blue. Option D. The fistula must be protected from injury, infection, and altered blood flow. The correct answer is option D. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Tourniquet decisions do not remove the risk to a fistula. Blood in the arm still contains cells. Tube color is determined by the collection container, not the arm. Question 32. Why is the site of a prior mastectomy often avoided for venipuncture in the physician office lab during a structured exam prep drill? Option A. Lymphatic changes can increase risk for swelling, infection, or complications. Option B. All specimens from that side clot immediately. Option C. The veins always contain arterial blood. Option D. The skin cannot be cleaned. The correct answer is option A. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. Specimens do not automatically clot because of collection side. Venous blood does not become arterial because of mastectomy history. The issue is not an inability to cleanse skin. Question 33. When N4 is running in one arm, which collection choice is usually preferred in the community health screening event during a clinical simulation? Option A. Ignore the 4 because additives prevent contamination. Option B. Use the opposite arm when available and follow facility policy. Option C. Draw above the foresight while fluid is running. Option D. Collect directly through the foretubing without authorization. The correct answer is option B. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from fluids. Tube additives do not correct fluid contamination. Drawing above a running fore can contaminate or dilute the specimen. Line draws require authorization and specific procedure. Question 34. For a ammonia collection, which finding makes a venipuncture site a poor choice in the preoperative testing area during a review? Option A. A site that allows safe patient positioning. Option B. A vein that is palpable and resilient. Option C. Edema, burns, scarring, or signs of infection at the site. Option D. Clean intact skin over an antecubital vein. The correct answer is option C. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. Safe positioning is desirable for venipuncture. A palpable resilient vein is generally a favorable finding. Clean intact skin supports safe site preparation. Question 35. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the oncology infusion center during a mock exam? Option A. Normal clot retraction in the vein. Option B. Proper tube mixing. Option C. Successful fasting status. Option D. Hematoma formation. The correct answer is option D. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Clot retraction is a laboratory process, not a normal event around an active needle site. Tube mixing happens after collection and does not cause local swelling. Fasting status cannot be determined by puncture site swelling. Question 36. If a hematoma starts to develop during venipuncture, which action is appropriate in the dialysis adjacent clinic during a skills check? Option A. Release the tourniquet, remove the needle, and apply pressure. Option B. Ask the patient to bend the elbow tightly. Option C. Continue filling all ordered tubes. Option D. Massage the swollen area vigorously. The correct answer is option A. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Bending the elbow can increase bruising and does not provide focused pressure. Continuing the draw can enlarge the hematoma. Vigorous massage can worsen bruising and tissue injury. Question 37. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the student skills lab during a practice drill? Option A. Give the patient food before removing the needle. Option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option C. Ask the patient to stand up and walk it off. Option D. Leave the needle in while getting more tubes. The correct answer is option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Food is not the first action while a needle is still in the arm. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Question 38. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the occupational health clinic during a scenario? Option A. Use the same bandage time for every patient without checking. Option B. Skip pressure to avoid bruising. Option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option D. Ask the patient to bend the elbow sharply. The correct answer is option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. Question 39. Before proceeding with the draw, which action helps prevent a hematoma after removing the needle in the blood collection station during a competency review? Option A. Remove the needle before releasing the tourniquet every time. Option B. Have the patient bend the elbow tightly. Option C. Rub the puncture site to spread the blood. Option D. Apply clean gauze with firm pressure while the arm remains straight. The correct answer is option D. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. Question 40. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the outpatient clinic during a final review? Option A. Possible arterial puncture. Option B. Normal capillary refill. Option C. Proper venous flow. Option D. Tube additive carryover. The correct answer is option A. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Question 41. In the hospital unit during morning rounds, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the hospital unit during morning rounds during a study session? Option A. Serum separator tube. Option B. Blood culture bottles or sterile culture tube. Option C. Lavender EDTA tube. Option D. Gray fluoride tube. The correct answer is option B. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Question 42. In the standard venipuncture order of draw, which tube usually follows blood cultures in the urgent care laboratory during a structured exam prep drill? Option A. Royal blue tube for every test. Option B. Lavender EDTA tube. Option C. Light blue sodium citrate tube. Option D. Gray fluoride tube. The correct answer is option C. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Question 43. To protect patient safety, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes in the pediatric clinic during a clinical simulation? Option A. Serum, lavender, blood cultures, gray, light blue, green. Option B. Lavender, gray, green, serum, light blue, blood cultures. Option C. Gray, lavender, green, serum, light blue, blood cultures. Option D. Blood cultures, light blue, serum, green, lavender, gray. The correct answer is option D. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Question 44. Why does order of draw matter during evacuated tube collection in the long-term care unit during a review? Option A. It helps prevent additive carryover from altering later specimens. Option B. It determines the patient's fasting status. Option C. It makes patient identification optional. Option D. It eliminates the need to mix tubes. The correct answer is option A. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Question 45. During capillary puncture, which specimen type is generally collected first when ordered in the mobile collection site during a mock exam? Option A. Non-additive tube after all others. Option B. Blood gas specimen. Option C. Serum specimen. Option D. Gray top microtube. The correct answer is option B. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Question 46. In a routine phlebotomy scenario, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the emergency department bay during a skills check? Option A. Any order because capillary tubes have no additives. Option B. Serum microtube before EDTA for every draw. Option C. EDTA microtube before other additive and serum microtubes. Option D. Gray microtube first even when blood gases are needed. The correct answer is option C. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time sensitive and generally come first if ordered. Question 47. Before proceeding with the draw, which tube is most appropriate for a routine CBC in the physician office lab during a practice drill? Option A. Red no additive tube. Option B. Light blue sodium citrate tube. Option C. Gray sodium fluoride tube. Option D. Lavender top tube containing EDTA. The correct answer is option D. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. Question 48. During a scenario, which additive is found in a light blue tube used for patient and NHACPT testing? Option A. Sodium citrate. Option B. Lithium heparin. Option C. EDTA. Option D. Sodium fluoride with potassium oxalate. The correct answer is option A. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Question 49. In the preoperative testing area, which tube is commonly selected for many serum chemistry tests when gel separation is desired in the preoperative testing area during a competency review? Option A. Gray fluoride tube only. Option B. Serum separator tube with clot activator and gel. Option C. Lavender EDTA tube. Option D, light blue citrate tube. The correct answer is option B, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Question 50. For a lactate collection, which tube is commonly associated with heparinized plasma chemistry testing in the Oncology Infusion Center during a final review? Option A, pink top tube. Option B, lavender top tube. Option C, green top tube. Option D, light blue top tube. The correct answer is option C, green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Question 51. To protect patient safety, which tube is most commonly used for glucose preservation when testing may be delayed in the dialysis adjacent clinic during a study session? Option A, blood culture bottle. Option B, plain red tube only. Option C, light blue citrate tube. Option D, gray top tube with sodium fluoride and an anticoagulant. The correct answer is option D, gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Question 52. After reviewing the order, which tube is commonly used for blood bank testing such as type and screen in the student skills lab during a structured exam prep drill? Option A, pink top EDTA tube. Option B, green heparin tube for every blood bank test. Option C, gray top fluoride tube. Option D, light blue citrate tube. The correct answer is option A, pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Question 53. When preparing for collection, which tube is generally collected for a blood culture specimen in the occupational health clinic during a clinical simulation? Option A, SST after clotting. Option B, sterile blood culture bottle or SBS containing culture tube according to policy. Option C, lavender EDTA tube only. Option D, gray fluoride tube. The correct answer is option B, sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. Question 54. Why must a light blue citrate tube be filled to the proper level in the blood collection station during a review? Option A, serum cannot clot unless the tube is full. Option B, the tube color changes if underfilled. Option C, the blood to anticoagulant ratio must be correct for coagulation results. Option D, EDTA needs extra room to mix. The correct answer is option C, the blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Question 55. After collecting an additive tube, how should it usually be mixed in the outpatient clinic during a mock exam? Option A. Open the stopper and stir with a wooden applicator. Option B. Shake it hard until bubbles appear. Option C. Leave it unmixed until centrifugation. Option D. Gently invert the tube the recommended number of times. The correct answer is option D. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Opening a tube risks exposure, contamination, and specimen loss. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Question 56. During a skills check, which problem can occur if a lavender EDTA tube is not mixed soon after filling? Option A. Microclots may form and make hematology results unreliable. Option B. The sodium citrate ratio improves. Option C. The tube becomes sterile for culture. Option D. The specimen turns into serum. The correct answer is option A. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Sodium citrate is not the additive in a lavender EDTA tube. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Question 57. In the urgent care laboratory, which practice helps reduce hemolysis during a routine lipid panel collection? Option A. Pull back a syringe plunger as hard as possible. Option B. Use appropriate needle size and gently invert tubes instead of shaking them. Option C. Force blood rapidly through a small needle. Option D. Shake additive tubes vigorously. The correct answer is option B. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Excessive syringe force can rupture cells and compromise results. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Question 58. For a troponin collection, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the pediatric clinic during a scenario? Option A. Tourniquet pressure becomes lower. Option B. Patient date of birth becomes invalid. Option C. Potassium may be falsely increased. Option D. Tube expiration date is extended. The correct answer is option C. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Question 59. When using a syringe for blood transfer, which method best protects specimen quality in the long-term care unit during a competency review? Option A. Shake each tube hard to remove clots. Option B. Remove the tube stopper and push blood in forcefully. Option C. Squirt blood through the needle into each tube. Option D. Use a safety transfer device and allow blood to flow gently into tubes. The correct answer is option D. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Shaking tubes can rupture cells and worsen specimen quality. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Question 60. Why should alcohol be allowed to dry before puncture in the mobile collection site during a final review? Option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option B. Alcohol drying replaces tourniquet use. Option C. Dry alcohol makes the tube additive stronger. Option D. Wet alcohol improves vein anchoring. The correct answer is option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Tourniquet use is a separate step for vein distension. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Question 61. When preparing for collection, which specimen often requires protection from light after collection in the emergency department bay during a study session? Option A, blood culture bottle during incubation. Option B, bilirubin specimen. Option C, CBC specimen for platelet count. Option D, routine sodium citrate coagulation tube. The correct answer is option B. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Question 62. In a routine phlebotomy scenario, which specimen commonly requires rapid transport on ice or chilled handling according to policy in the physician office lab during a structured exam prep drill? Option A, blood culture bottle placed in the freezer. Option B, routine CBC kept for the next day. Option C, ammonia specimen. Option D, serum separator tube for a lipid panel after clotting only. The correct answer is option C. Ammonia specimen. Ammonia specimens are time sensitive and commonly require chilling and prompt processing. Blood culture bottles should not be frozen because organisms must remain viable for detection. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Question 63. Before proceeding with the draw, which action best maintains specimen integrity during transport to the laboratory in the community health screening event during a clinical simulation? Option A, place all blood specimens in direct sunlight. Option B, store every specimen at room temperature overnight. Option C, centrifuge every tube immediately regardless of type. Option D, follow required time, temperature, light, and handling instructions for the ordered test. The correct answer is option D. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Sunlight can degrade light-sensitive analytes and warm specimens. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Question 64. If a specimen must be transported cold, which approach is appropriate in the preoperative testing area during a review? Option A, place the specimen in the approved cooling method without direct water contamination. Option B, place it near a heater until pickup. Option C, submerge the tube in loose ice water. Option D, hold it in a bare hand to keep it visible. The correct answer is option A. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. A heater can destabilize temperature-sensitive analytes. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. Question 65. In the Oncology Infusion Center, which situation is a common reason for specimen rejection in the Oncology Infusion Center during a mock exam? Option A, tube was labeled at the bedside. Option B, wrong tube type or insufficient specimen volume. Option C, collector wore gloves. Option D, patient stated date of birth. The correct answer is option B. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Bedside labeling is the correct practice. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Question 66. Why should tube expiration dates be checked before collection in the dialysis-adjacent clinic during a skills check? Option A. Expired tubes are required for coagulation testing. Option B. Expired tubes identify patients faster. Option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Option D. Expired tubes prevent hemolysis in every case. The correct answer is option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Coagulation testing requires properly filled, unexpired citrate tubes. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Question 67. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the student skills lab during a practice drill? Option A. Cancel every test without notifying anyone. Option B. Draw the specimen and write fasting on the label. Option C. Tell the patient not to mention the meal. Option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. The correct answer is option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Canceling without communication may disrupt care and exceed the phlebotomist's role. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Question 68. Why is fasting status important before some chemistry tests in the occupational health clinic during a scenario? Option A. Food intake can alter analytes such as glucose or lipids. Option B. Fasting eliminates the need for tube mixing. Option C. Food changes the patient's legal name. Option D. Fasting makes needles sterile. The correct answer is option A. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Additive tubes still require proper mixing regardless of fasting status. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Question 69. For a medication trough level, when is the specimen usually collected in the blood collection station during a competency review? Option A. Only after the medication is discontinued for a week. Option B. Immediately before the next scheduled dose. Option C. Immediately after the medication is swallowed. Option D. At any random time during the day. The correct answer is option B. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Stopping medication for a week is not the routine way to collect a trough. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Question 70. During a glucose tolerance test, why must collection times be followed carefully in the outpatient clinic during a final review? Option A. The patient should eat between timed draws to stay comfortable. Option B. Any time is acceptable if the tubes are gray. Option C. Timed results show how the body responds to a measured glucose dose. Option D. Timing only matters after the last tube. The correct answer is option C. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Eating during the test can invalidate the glucose response pattern. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Question 71. Before proceeding with the draw, which documentation is especially important for a timed specimen in the hospital unit during morning rounds during a study session? Option A. A note saying collected sometime today. Option B. The phlebotomist's favorite tube brand. Option C. Only the patient's room number. Option D. Exact collection time recorded on the label or requisition according to policy. The correct answer is option D. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Vague timing can make the specimen clinically unreliable. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Question 72. Before collecting blood cultures, why is careful skin antisepsis critical in the urgent care laboratory during a structured exam prep drill? Option A. It reduces contamination that could cause a false positive culture. Option B. It changes venous blood into arterial blood. Option C. It makes EDTA tubes clot faster. Option D. It eliminates the need for sterile bottles. The correct answer is option A. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. Skin antisepsis does not change the type of blood collected. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Question 73. When collecting blood cultures with other tubes, which priority is most important in the pediatric clinic during a clinical simulation? Option A. Use a non-sterile transfer cup. Option B. Maintain sterility and collect cultures before non-sterile tubes. Option C. Collect cultures after gray tubes. Option D. Touch the bottle tops after cleaning to confirm dryness. The correct answer is option B. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. A non-sterile transfer process defeats the purpose of sterile collection. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. Question 74. If using a winged set for blood cultures, why is bottle order guided by facility policy in the long-term care unit during a review? Option A. The order makes the needle reusable. Option B. The order determines the patient's identity. Option C. Air in the tubing can affect which bottle should be filled first. Option D. The order prevents the need to clean the site. The correct answer is option C. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Needles are single-use and cannot be reused. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Question 75. For a legal blood alcohol collection, which requirement is especially important in the mobile collection site during a mock exam? Option A. Let the patient carry the open tube to the lab. Option B. Use alcohol swabs for every blood alcohol specimen. Option C. Leave the specimen unlabeled until court. Option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. The correct answer is option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Allowing the patient to carry an open specimen compromises custody and security. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Question 76. After reviewing the order, which action best supports chain of custody for a drug screen specimen in the emergency department bay during a skills check? Option A. Document each person who handles the specimen from collection to transfer. Option B. Discard the seal after collection. Option C. Use only verbal handoff with no signatures. Option D. Store the specimen in an unlocked public area. The correct answer is option A. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. A broken or discarded seal weakens evidence of tamper control. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. Question 77. Why are tamper-evident seals used on forensic or workplace testing specimens in the physician office lab during a practice drill? Option A. They prevent the need for a requisition. Option B. They help show whether the specimen was opened or altered after collection. Option C. They replace patient consent. Option D. They make refrigeration unnecessary for all tests. The correct answer is option B. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A requisition or custody form is still needed for proper processing. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. Question 78. A child begins to pull away during a draw. Which action supports safety in the community health screening event during a scenario? Option A. Ask another child to hold the arm. Option B. Continue while the arm is moving. Option C. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option D. Scold the child until they stop. The correct answer is option C. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Another child is not appropriate assistance for a procedure. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Question 79. Before proceeding with the draw, which explanation is best for a young child before a finger stick in the preoperative testing area during a competency review? Option A. Promise a toy only if they do not cry. Option B. Tell the child nothing will happen. Option C. Use detailed adult medical terminology. Option D. Use simple honest words such as a quick pinch and explain what they can do to help. The correct answer is option D. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Tying a reward to not crying can shame a normal fear response. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Question 80. For an older adult with fragile veins, which technique is most appropriate in the Oncology Infusion Center during a final review? Option A. Use gentle anchoring and consider a smaller needle or controlled collection device. Option B. Leave the tourniquet on for several minutes. Option C. Slap the site hard to make veins appear. Option D. Use the largest needle available. The correct answer is option A. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Prolonged tourniquet time increases hemoconcentration and bruising risk. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Question 81. Why should adhesive bandages be used carefully on some older adults in the dialysis-adjacent clinic during a study session? Option A. Bandages prevent all anticoagulant bleeding. Option B. Fragile skin can tear when adhesive is removed. Option C. Adhesive changes the blood type. Option D. Older adults never need pressure after draws. The correct answer is option B. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. A bandage does not eliminate bleeding risk, especially with anticoagulants. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. Question 82. Before assembling equipment for a patient/INR which item should be checked in the student skills lab during a structured exam prep drill? Option A. The brand of wall clock in the room. Option B. Only the color of the chair. Option C. Tube type, expiration date, needle safety device, and requisition requirements. Option D. The patient's favorite beverage. The correct answer is option C. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. The wall clock brand does not confirm correct supplies or orders. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. Question 83. To protect patient safety, which sequence is safest after blood has entered the final tube in the occupational health clinic during a clinical simulation? Option A. Remove the needle and recap it before pressure. Option B. Withdraw needle with tourniquet tight and no gauze ready. Option C. Activate safety device before removing the needle from the arm. Option D. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The correct answer is option D. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Recapping a contaminated needle creates sharp's injury risk. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Question 84. After reviewing the order, which action should occur before leaving the patient after venipuncture in the blood collection station during a review? Option A. Confirm bleeding has stopped and provide appropriate post-draw instructions. Option B. Dispose of sharps after walking to another room. Option C. Leave while blood is still oozing. Option D. Tell the patient to remove the bandage immediately. The correct answer is option A. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Sharps must be disposed of promptly in the collection area. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Question 85. Why is patient positioning important before venipuncture in the outpatient clinic during a mock exam? Option A. It allows the needle to be reused safely. Option B. It reduces the risk of falls or injury if the patient becomes dizzy. Option C. It makes labeling unnecessary. Option D. It changes EDTA into citrate. The correct answer is option B. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Needles are single-use and cannot be reused. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Question 86. In a routine phlebotomy scenario, which patient instruction is appropriate after a routine venipuncture in the hospital unit during morning rounds during a skills check? Option A. Bend the elbow tightly for 10 minutes. Option B. Scratch the site if it feels itchy. Option C. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option D. Remove the bandage while still bleeding. The correct answer is option C. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Bending the elbow tightly can increase bruising. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Question 87. Before proceeding with the draw, which laboratory department commonly performs CBC testing in the urgent care laboratory during a practice drill? Option A, histology only. Option B, microbiology only. Option C, blood bank only. Option D, hematology. The correct answer is option D, hematology. Hematology evaluates blood cells and commonly performs CBC testing. Histology focuses on tissue specimens rather than routine CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Question 88. During a scenario, which department usually performs patient and APTT coagulation testing? Option A, coagulation or hematology coagulation section. Option B, cytology screening only. Option C, urinalysis only. Option D, microbiology culture bench only. The correct answer is option A, coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Cytology examines cells for diagnostic changes, not standard coagulation studies. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Question 89. In the long-term care unit, which department is most associated with blood cultures? Option A, chemistry electrolyte analysis only. Option B, microbiology. Option C, blood bank compatibility only. Option D, histology tissue processing. The correct answer is option B, microbiology. Microbiology processes cultures to detect and identify microorganisms. Chemistry analyzes chemical constituents and is not the main culture department. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Question 90. For a hemoglobin A1C collection, which department commonly performs type and screen testing in the mobile collection site during a final review? Option A, parasitology stool testing only. Option B, microbiology only. Option C, blood bank or transfusion services. Option D, chemistry only. The correct answer is option C, blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Parasitology stool testing does not perform transfusion compatibility testing. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Question 91. To protect patient safety, which department commonly analyzes electrolytes such as sodium and potassium? Option A, cytogenetics only. Option B, histology. Option C, blood bank compatibility bench. Option D, chemistry. The correct answer is option D, chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Question 92. After reviewing the order, which practice is part of phlebotomy quality assurance? Option A, tracking specimen errors and using corrective action to prevent recurrence. Option B, skipping competency checks for experienced staff. Option C, ignoring mislabeled specimens if the patient is well known. Option D, changing tube labels after results are reported. The correct answer is option A, tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Competency checks help maintain consistent safe practice for all staff. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability. Question 93. Why are competency assessments important for phlebotomists in the community health screening event during a clinical simulation? Option A. They are only for patients who complain. Option B. They verify that staff can perform required skills safely and consistently. Option C. They replace all written procedures. Option D. They allow staff to ignore order of draw. The correct answer is option B. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Competency is a proactive quality process, not only a reaction to complaints. Written procedures are still needed as standards for practice. Order of draw remains important regardless of competency status. Question 94. In a routine phlebotomy scenario, which error should be reported through the facility's quality process? Option A. A needle safety device is activated after use. Option B. A patient correctly states their date of birth. Option C. A specimen collected in the wrong tube type. Option D. A tube is mixed according to instructions. The correct answer is option C. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Activating a safety device after use is the intended safety behavior. Correct identity confirmation is expected practice, not an error. Proper tube mixing supports quality. Question 95. Before proceeding with the draw, which activity is commonly associated with CLIA waived point-of-care testing? Option A. Using expired test strips because they look normal. Option B. Changing the test procedure to save time. Option C. Reporting results without controls when controls are required. Option D. Following manufacturer instructions and documenting quality control for a simple approved test. The correct answer is option D. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Expired strips may produce inaccurate results even if they look acceptable. Modifying the procedure can invalidate the test category and results. Skipping required controls undermines result reliability. Question 96. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the dialysis-adjacent clinic during a skills check? Option A. Confirm test strip expiration and run required quality control according to policy. Option B. Apply disinfectant and test before the site dries. Option C. Use a strip from an unlabeled loose container. Option D. Skip patient identification because the device stores results. The correct answer is option A. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Testing before the site dries can contaminate or dilute the sample. Loose unlabeled strips may be expired or contaminated. Device storage does not replace identifying the patient. Question 97. Why must abnormal point-of-care results be handled according to facility policy? Option A. The patient should interpret the result without staff involvement. Option B. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option C. Abnormal results should always be erased. Option D. Only normal results belong in the medical record. The correct answer is option B. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Erasing abnormal results hides clinically important information. Both normal and abnormal results may require documentation. Question 98. For a basic metabolic panel collection, which blood component is primarily responsible for carrying oxygen? Option A, tube separation gel. Option B, sodium citrate in plasma. Option C, hemoglobin inside red blood cells. Option D, platelet granules only. The correct answer is option C. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Separation gel is part of a tube system, not a blood component. Sodium citrate is a tube additive, not an oxygen carrier. Platelets help hemostasis but do not primarily transport oxygen. Question 99. To protect patient safety, which blood component is most directly involved in forming the initial platelet plug? Option A, chloride ions. Option B, albumin only. Option C, glucose molecules. Option D, platelets. The correct answer is option D. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Chloride is an electrolyte and does not form platelet plugs. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Glucose is an energy source, not a clotting cell fragment. Question 100. After reviewing the order, which vessel type is normally used for routine venipuncture? Option A, vein. Option B, tendon sheath. Option C, artery. Option D, lymphatic duct. The correct answer is option A. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. A tendon sheath is not a blood vessel and must be avoided. Arterial puncture is a different procedure and not routine venipuncture. Lymphatic ducts do not provide venous blood specimens.